when I'm recovering from my surgery, what's the best thing I can do to help myself recover? Is it about resting as much as possible? Is it about starting to exercise, and how soon is that safe? And a little bit about caring for my wound. I think it can be quite scary for people when they've had surgery and they're left with wounds to manage, is what to look out for and how to make sure you're not getting any infection.
It's obviously very important for the patient to realize that it's not only the surgery as such, so it's not only the surgeon who is providing the surgery, but it's actually teamwork, including the patient's involvement. So not only is it helpful when the patient optimizes themselves before operation, but it's also very helpful to have an active involvement of the patient after surgery, because for example, me as a surgeon, it's probably not enough for the patient to not do anything whole day just waiting for me to see them. As an example, every patient has some risk of developing clots in the legs and lungs. So how they can prevent it is even if they are in a bed, they can move their feet up and down. They can take a deep breath and coughing exercises to prevent chest infections. They should involve themselves actively with physiotherapy so they are mobilized early. And all these little things are potentially preventing complication which might be serious. So again, active involvement of the patient is very important. It's a scary moment for the patient to go home, because in a hospital, if they have any problem, they buzz the buzzer, and there will be always somebody around, be it nurses or carers or doctors. And obviously, when they are sent home, all this buzz is over, so they can't do it at home. However, we are making sure that patients who are going home are ready to go home. So as I mentioned, they usually are able to mobilize as they did before surgery, meaning if they are living in a bungalow, they should be able to walk on a flat. However, if they live in a house with stairs, they usually need to have a so-called stair test, and the physiotherapist is assessing the patient to clarify if they can walk the stairs as they did before the surgery. It might be a little bit lonely moment when they are at home as well, because some people like the attention in hospital as well, understandably, and there are a lot of people who are taking care of them. And when they go home, especially when they are living alone, it might be a little bit lonely experience, because all of this sort of support, they might feel that they are sort of left on their own. So we usually recommend for patients who are living on their own that if they have somebody from the family who can stay with them for a week or so, or if they can arrange somebody from the street or friends, at least to be on the phone in a case that they need some help. Not necessarily with health problems, but for example, cooking or bringing the shops or doing the bins or sort of little things like that. As regards wounds, the wounds are usually checked before the patient is discharged home. What I found is that mostly the wound which is causing slightly trouble might be the wound where the drain was, because it's not a wound which is sutured immediately after surgery, but it's something which will heal after the drain is removed. So occasionally there might be a bit of discharge of fluid. Again, a very small amount of discharge is completely fine, and the patient doesn't need to be worried. There might be a little bit of redness because the wound wasn't closed immediately during the surgery as such. And on some occasions, the patients go to GP to have some antibiotics as well to clear the little bit of redness of the chest drain as such. Patients are usually provided with the contact details for hospital and on-call registrar or specialist nurses, so they always have contact in a case they need a little bit more advice. On some occasion, when we feel that they need to be reassessed, then obviously they will come back to A&E and we will reassess them over there. So the healing of the wound takes some time, so it depends if the patient had a keyhole operation or if the patient had a thoracotomy. I usually recommend for patients who had a keyhole operation not to lift anything more than 10 pounds for about 5-6 weeks, and patient who had thoracotomy not more than 10 pounds for 3 months. As regards activity, they can walk as much as they want. There is no limitation. So again, it's important that when they come home, occasionally people have a bit of feeling down and they are not sure exactly what they can do, and they sort of spend, some patient might spend more time in a sort of chair than that would be beneficial for them. So nobody needs to worry about walking. They can walk as much as they can, and they were assessed that they are stable and that they are safe to walk, not only on a flat, but if they have a stairs at home, on a stairs as well. So walking completely unlimited, but as I mentioned, if they would like to do certain exercise like heavy lifting or cycling or swimming, I would probably wait until full recovery, meaning 5 to 6 weeks after keyhole operation, and about 3 months after the thoracotomy as such.